I just want to start off by putting a big thank you out to the BC Support Unit, not only for the opportunity to present for the webinar, but also, as we'll get into a bit later, myself and my research team have been fortunate enough to receive a BC Support Unit planning grant. And much of what we're talking about today is what we've been able to do with that. And the team across the board, whether from getting the grant even to Magdalena, Lupin, Rableen, Justin, Brittany, just throughout the process have been really great. So thank you to all of you for that. And I really encourage those who are interested in patient-oriented research to reach out to your local BC Support Unit. They're invaluable resources. So today, like Justin mentioned, I'm going to chat a little bit about our research project. I just wanted to start off, and if I can get this working, there we go. Just share with you our research team. So this picture here is each one of our research team members. And although I'm the one speaking today, I'm here on behalf of our entire team. And I'll talk a little later about the composition of our team, but we're a very fortunate group to have diverse stakeholder backgrounds and experiences at the table. Also, I've chosen, because I have a shared office, not to share video, but just wanted to note, so I'm in the upper right corner there. So for today, I just want to start off with a little bit of background about our topic, and then diving into what our research journey was like, and then finish off with some reflections. I picked the picture here just because I think it really captures not only our research team's journey, but many research journeys. There's a lot of twists and turns in research, but what I really appreciate is that each one of those changes gives us a different vantage point on the topic or the population we're looking at. And I think despite the hard work that it takes and, again, the twists, we really get to see some amazing things out of it. So to start off, I just wanted to share a little bit about what tube feeding is. So I'm a registered dietitian by trade, and that's what I do when I'm not doing research. And so I just wanted to go through some of the terminology that might be more familiar to myself, but not everybody listening. So tube feeding is something that is used to provide food and fluid through a tube, sometimes temporarily placed through the nose or mouth, as you can see in the picture, or sometimes more permanently placed in the abdomen, as seen in these lower items. And that takes place when people aren't able to meet their nutrition needs by mouth. And so it's quite common in hospital settings for tube feeding, again, especially those temporary tubes to be used. But we're starting to see an increase in home use as well. And the reasons why this will take place are multifactorial. The purple words highlighted here just mention some of the key symptoms that cause the need for tube feeding when people can't meet their needs by mouth. So for example, swallowing difficulty, obstructions to the GI tract, whether in the esophagus or lower down, emptying issues, or even malnutrition. But these symptoms are caused by underlying medical conditions. So things such as head and neck cancer, that being the largest, it is generally the largest proportion of the home tube fed population, as well as stroke, and then other neuromuscular conditions such as MS, ALS, or in cases of the stomach emptying problem, advanced diabetes. So the population we're looking at is quite diverse, both in the things that cause them to need tube feeding, but also the medical conditions underlying them. So this is tube feeding as a whole, but really what home tube feeding looks like is that transition of the care for tube feeding from the hospital to the user or caregiver themselves. And so in the hospital, tube feeding is managed by a team. There's a dietitian, a nurse, a pharmacist, physician, many other individuals involved. And as we move people to go home on tube feedings, there's this interaction between the user or caregiver and the staff to provide that education. So really this overlap and support, but there's still that shared responsibility. But when home tube feeding really takes place, it's that final endpoint where the user and caregiver themselves becomes, in many ways, the sole person doing all of these tasks that in the past have been sometimes managed by a team. And so there's some good literature to support that there's over 30 daily tasks involved in doing a correct infusion of home tube feeding. And so you can imagine with that many individual tasks that, again, were shared by a team in the past and now fall on potentially one or two people, there's a lot of room for issues, complications, and questions as people move home. And so that kind of sets the background for, again, what tube feeding is and how that transition works. So the research question in this topic really came out of some observations myself and my colleagues were having. As dietitians, we were finding when we were referring our patients who were heading home on tube feeds, those options were very limited. People would either be seen only in clinics for a wide variety of individuals, so a separate clinic for their swallowing issues, a separate clinic for their dietitian, their local pharmacist, their family doctor, a separate wound care clinic. And most of these things required people to travel, which, as you can see with some of the conditions we talked about, that might be an issue. And also, again, are all individual appointments, so quite a full follow-up schedule for these patients. And then the other thing we saw is that these people were coming back to the hospital with tube-related issues. And we felt like that a lot of these issues seemed to be things that could be managed in the community but weren't. And so again, these were just some observations, but we decided to open the conversation more and discuss with colleagues across our region. And we were able to actually hear a little bit about different programs across the country. So specifically, Alberta and Manitoba have coordinated care programs where all patients, specifically adults who go home on tube feeds, go to one location where they see a specialist, SLP, dietitian, pharmacist, SLP being speech and language pathologist for the swallowing issues. And again, so one location. In many of these programs, they do often visit the house either once or as an option ongoing. And the benefit being is that these clinics or these programs are dedicated to adult home tube feeding, whereas in Fraser Health, it's generalists that you're seeing. So people don't have as much of that specialized knowledge. And so that really led us to the question is there something in the literature to say this is the gold standard of care for this population, something we could roll out right here locally? And so we conducted a literature review, but we only found about 3 Canadian studies, and they were all descriptive on only of these two populations that already had existing programs, so Alberta and Manitoba and their characteristics. So it didn't really give us much insight into the impact of starting a program or what that looked like. So we broadened our literature search and were able to find the following review, which was published in 2013, that looked at describing all of the different interventions across the world that provided tube feeding care. And what they really found was that there wasn't high enough quality of evidence to suggest a specific intervention, but instead, it seemed to be that those interventions that were derived from local processes and environments tended to do the best, which I think resonates with healthcare decision makers and healthcare professionals on the fact that if we can meet the needs of our patient population, in theory, the impact should be better. And so for us, that really led to this overarching goal to improve the care provided to home tube feed users living within BC by meeting their express needs, so understanding what they really need. And I think this kind of opened the doors to some discussion about, I think in healthcare we talk a lot about patient-centered care and making things that meet those express needs, but we don't always go out there and actually engage our patients in that process. And so, we knew that that's what we wanted to do. We wanted to create these programs that met their express needs. And so in order to do that, we actually needed to go out there and understand their express needs, because this population, we don't know those answers in BC. But this is where we ran into some other issues. Within Canada, BC, and even locally, there's no tracking for adult home tube feed users. We actually don't know the full extent of this population, where they are, who they are. And so this led to kind of a further step back is we need to find the population first. So again, this all kind of came out of the idea of let's improve care, but we ended up really having to focus back on just finding the population itself. And so that started our research journey. So in 2016, I led a team of students. We have dietitian students each year do research projects, so we were able to leverage that group. Some healthcare leaders and frontline staff to actually try and look at the literature and specifically the charts to get an idea of who is out there. So we looked at charts between 2012 and 2016 and collected information on any adult who went home with a new tube from a Fraser Health facility within that time period. And then we also looked at how often they were getting follow-up with a dietitian to better describe what that rates of follow-up looked like. And so we found that a fairly sizable population for Fraser Health was going home. Over that 3-year period, there was 390 new adult home tube feed users discharged. And what's important to remember for that number is it does not include those individuals who had a tube placed in another health authority, such as Vancouver Coastal, but live in the Fraser Health region and would receive their community services there, and those who already were living with a tube. We only looked at those newly discharged. So again, about just over 100 people going home a year newly on tube feeds. When we looked more specifically at the demographics, we found population distribution. If you are not familiar with the Fraser Health region, Surrey is our largest population size. So not surprisingly, you can see that larger red circle there denoting that Surrey did have a large proportion of people going home. And we found that the demographics were very similar to those in the few studies describing other Canadian populations, mostly male, and a little bit of a younger than the typical hospital population. And that has a lot to do with the common underlying condition of head and neck cancer. That population tends to be male and tends to be a little bit younger, so reflected in those numbers. But the other interesting thing we looked at was income. And we found that the median income, if we look at how much tube feeding on average costs, households would be spending about 16% of their household income on tube feed formula, and that's pre-tax. To put that in context, the same year of 2015, if we looked at how much it costs to feed a family of 4 using some standardized provincial numbers, we would expect a family of 4 to be fed on 16.6% of an individual's income, a household's income. And in this situation, this population, we're suggesting that almost all of that money that should be feeding a family for is only feeding, one home tube feed user. So identifying, some potential for some key economic issues for this population. The other thing we found that was very surprising was the very low rates of dietitian follow-up. So only 25% of those people in our sample actually saw a dietitian in the community up to 3 years after discharge, which as a dietitian was concerning, but we allowed it to reflect on what we had already had concerns about our community supports. So we definitely had a lot of questions coming out of this. We went on the next year kind of building on that study and looked at the same population but using a different team, some different research students. And we looked at the healthcare usage behaviors of this same 390 patients. And what we found was shocking. We found that there was a total of 311 tube feed related visits to either the emergency room or the hospital ward over 6 years. And that these visits were estimated to cost up to $14.3 million for just this small group of 390 people. And you can see based on the length of stay, part of that has to do with several of the lengths of stay in the hospital being quite long, up to about 220 days, but a number that's fairly staggering. So these two findings together, the identification of poor usage of dietitian services and very costly tube feed related visits, raised a lot of questions for us about what is going on right now and how are people experiencing tube feeding in the community and how is that affecting their use of the healthcare system. And so this led into our goal, which we had from the beginning anyways, of really going out there and understanding the expressed needs of this population. And so this past year, using the BC Support Planning Grant, we've had the opportunity to sit down and answer this question, or begin to. And given up until this point, we didn't really know who our population was. As we moved forward, there really was an intentionality from myself and my research colleagues that we really wanted to engage patients in this opportunity now that we kind of knew who was out there or where we could access them. And so this is where, in theory, our patient-oriented research started, although our desire to do this was very much from the beginning. And I think for me, upon reflection with patient-oriented research, I think this really is the key for as health authorities and healthcare researchers to creating not just patient-centered care, but evidence-based programs that really meet patients' needs. There's this image from the BC Support Unit website that I think really captures it well. When we engage patients as partners early, when we're building the evidence, we're going to make sure that we're ending up with programs that are built on good evidence, but also right from the beginning built with our patients involved in that. We're identifying their priorities and their outcomes right at the beginning, which I think is so important. And so we've, as a team and as I share, have really learned so much from our patient partners. And I just would encourage those who do research to really consider right from the beginning having patient partners involved. Whether it's all the way back to creating that research question, we want to be researching things that are meaningful to these people we want to, ultimately see an impact in. And so engaging them as a partner, same level, valuing their expertise as much as our, researcher, I think is what helps build that to take place. So for our planning grant, our team is diverse. I showed that picture at the beginning, and I have it again here. We have a combination of frontline clinicians, so 3 frontline dietitians, including myself. We have 2 home-to-feed users, John and Terry, and so they're located kind of on the right, upper, and bottom. We have Kea, who is a caregiver for John, and then we have also our academic partner of Dr. Kassam from UBC, and then some healthcare decision makers to help us really make sure we're making that relevant. And I can say working with this team has been such a joy. We really have been able to come together and respect each other's areas and areas of expertise and see a lot of really great planning, both from our research level, but also individual changes to our practice have already taken place for our frontline dietitians by just engaging with our patient partners from the beginning. And so as a team, we really determined that the question we wanted to explore were, what are the experiences and challenges of adults living at home with tube feeds? And the way we felt best to do this was through individual interviews. So as a team, we went through the literature to try and understand, just what are the current understandings of some of those experiences globally? There's not as much done in Canada in regards to home tube feed users, and very minimal, actually nothing in BC, and nothing for a diverse audience that we have. And so we looked at that, and then we, as a team, sat down and said, okay, well, what are the specific experiences we make sure we want to hit? And from that, we created an interview guide, so a specific set of questions to try and tease out what experiences and challenges people are living with. We went on to pilot those interviews, and so we conducted 3 interviews with 2 home tube feed users and 1 caregiver. And right now we're in the stage of just going over that data to make sure we feel like we caught the information we wanted to. We're going to tweak that interview guide a bit, and then we're just in the process of writing a few additional research grants to be able to fully scale this study to really get out there and ask the full population what are their experiences. And so I just wanted to share briefly some of the things we found as a team. These are very preliminary findings, and we don't have specific themes, so take it with caution. But these are some things that have been really meaningful to our research team as we've been reflecting. And so the first one is just this quote from a home tube feed user. Once I got used to the idea that you actually don't have to do it, tube feeding, at the same time every day, it's just like eating. Sometimes you're a bit hungry earlier. It was pretty easy. And so this for us was really just driving home that concept, and this is something our patient partners have reflected with us as well, is just as healthcare professionals, we sometimes can view things very medically. And for a lot of people, that shift away from the medical procedure to more of, it's just like food, it's like something I know, is really meaningful. And then from our caregiver side, this was something we heard was, I mean, there's general support groups for anxiety, like more mental health things. But as far as caregiving for somebody with a chronic illness, I don't see those being provided. And so this helped, to identify some issues that are out there, and we look forward to exploring this more. What are some of the gaps in the healthcare system? And so these preliminary findings have led to some practical reflections for us as healthcare professionals already, and we've actually been able to disseminate some of these just initial reflections to our dietitian team for them to think more about when they're doing that home tube feeding teaching, what should we be focusing on? And so the first reflection we had was providing choices. So there's many different ways to provide tube feeds, and I won't get into it in depth, but you can use pumps or gravity, and those different options have different pros and cons. Sometimes dietitians will just come out and only talk about one option, and then people go home and learn about these different ways. And so enabling our home tube feed users to know the options, again, really helps remove that medical aspect to it and turns it more into that patient-centered care. The other thing is avoiding strict schedules. So as clinicians, we typically use a lot of numbers in the hospital. We have to say what time we're going to give that first feed because the nurses need to know. And traditionally, those numbers were then translated at home. We would say, at 8 o'clock you're going to have a feed, at noon you're going to have a feed, and at 5 p.m. you're going to have a feed. And upon reflection, our team really thought about the fact that if we're talking about food, we probably need to be using words more like breakfast, lunch, dinner, because it doesn't really matter in most situations whether you're having it exactly at 8 or 8:05. Like our participant reflected, it's just food. You may be hungry earlier. Go ahead and have that flexibility. And then the last reflection we had is just encouraging social support. Traditionally, that's not something as dietitians we would have brought up in our home tube feed teaching. And there are some limits to those supports that are out there, which is, as I build on things we'll look to do hopefully in the future as we hear more from a population. But just bringing this into the conversation with your patients is mentioning that and recognizing that social support's probably needed. And so getting people to reflect and be mindful of what that would look like for them. So again, these are just some of the outcomes that we've seen already of just doing that small pilot study as we go forward. And so if we're thinking of that original idea of finding the population, talking to the population, which as I highlight here really is ongoing. We by no means think we're done doing that. But ultimately creating patient-centered programs, we have been able to see some really great outcomes already. Fraser Health has been responsive to that original data, the numbers data, and they actually came out and created 2 new home health dietitian positions in traditionally underserved areas. So Langley and Surrey didn't have those positions before. Upon reflection, though, as I've been writing some of my grants, it's great to see the health authority move on these things, and I applaud their readiness. But it'll be curious to see, given that these were created without us talking to the population yet, how our recommendations likely will change as we hear more about what it actually are the express needs of this population. And so the impact of these direct positions, may or may not be limited based on how well we're meeting those needs. And so that's why, we're going to keep moving forward. More advocacy needs to take place as we hear more from our population. And so that really brings me to where we are today. So we're really still in that bottom end. We have a better understanding of our population, but we're really needing to continue our research, understanding the express needs. And so that's where our research team that I showed earlier are continuing with us. Our patient partners have agreed to continue on with our research, and we really value that. Their expertise and experience really has been invaluable. And then also as we move forward, we've been reflecting with some of their suggestions about thinking about how we share our findings, going out and sharing with the population and actually asking them as they reflect on the needs they hear of their colleagues, is what do they suggest the programs will look like? And so again, really involving end users. I think we sometimes think of knowledge translation and we just want to rope those people in at the end. But having our patient partners be a voice the whole way through, I think really gives us the ability, again, to create those evidence-based programs from the beginning that really focus on our patients. So again, if there's researchers out there, I would really encourage you to reflect on incorporating patient-oriented research into what you're doing. And so I just want to highlight some key supports that have been really great for us that I would recommend to any researchers. Or if you're a patient listening to this and want to get involved, these are great people to help identify researchers who are looking for people. The first one is the BC Support Unit. And again, I can't speak highly enough of the opportunities they have both for researchers and patient partners in training and expertise. And I believe there's local units across the province, so finding one that's near you. And then the Patient Voices Network is someone else who we've worked with. They were really great at recruiting and orienting our patient partners. It's been helpful for me as the team lead to know that my patients have someone to support them. We have, again, I can't speak highly enough of our patient partners. They're really great people. They come to the table with really meaningful insights. They think outside the box. But I know at the end of the day, sometimes us in the health authority, we view things a specific way. And so knowing that they're supported with some outside support through Patient Voices Network has just helped me feel that much more confident in having our patients supported. So yeah, so I would just encourage researchers to reflect on that. And if you have a need, reaching out to these different resources. So that kind of ends my formal presentation. My goal was to be short and sweet, so we have some time for questions. Or I do appreciate it's lunch, and I'm a dietitian, so I'm mindful of that. But I just want to thank again the BC Support Unit for everything they've done up until this point and ongoing. Our team has really deeply appreciated that. And we, as a team, have also been given the opportunity over this next year to actually get some additional training in patient-oriented research. There's a fellowship that we've been awarded, and so that's something both myself and my patient partners will be doing over the next year for us to continue to be more of an expert in that. Also, within Fraser Health, we have a wonderful research and ethics department. There is an amazing team there that really, without it, none of this would get done. Just really great experts, and I appreciate everyone there. And then the students that did a lot of that initial work, and then our final team members. I could go on for a while, but for the sake of time, I will leave the names up there and give a thank you out. And if I miss someone, I do apologize. There's been a lot of teams and people that have really supported us in this whole journey. So I just want to open the floor to any questions. I will pass it back to Justin on how best to do that.
Yeah, so if anyone has any questions, now is the time. If you are joined afterwards, if you would like to ask a question, you can either unmute your mic by clicking on your name in the participants list and clicking on that little mic icon, ask it directly, or you can raise your hand. There should be a little hand icon next to your name in that list as well. So if you click on that, it will raise your hand and let Rebekah know that you have a question. And you can also use the chat function. So if anyone has any questions they'd like to ask, now is the time. Maybe one question that I have to get started, Rebekah, is I was wondering if, have you in the past before this project, have you worked on a lot of patient-oriented kind of research projects? And if not, kind of what were some of your learnings from that process?
Yeah, thanks. Great question. No, I haven't. And so I think going into it, I wasn't sure how it was going to be to have these patient partners in the room. In healthcare, and when we get our academic partners and everybody on board, we can be using a lot of lingo. And so the question was, are we really just going to scare these people away? And like I mentioned, I think partly because of the Patient Voices Network did a really great job in recruiting people with skills that would be really meaningful to our team. And partly just, I think, patient partners are experts in their lived experiences. And when we're looking to learn about that, they bring a lot to the table. So, I was really pleasantly surprised at, just how well it went. It was very smooth. There really, knock on wood, have not been many big issues. Our team works well together. People are good at voicing their opinions, being collaborative. And there actually have been some really great collaborations between our patient partners and actually our department. We've done some education for our dietitians just on them hearing our patient partners' lived experience across all our different sites, and that's led to some interesting practice changes as well. And so, I feel very fortunate to have met and worked with and continue to work with our patient partners. They're a highlight of my team.
Very cool. Are there any other questions that anyone would like to ask? Oh. Okay, well, nobody's raising their hand, so I think that might be it. Thank you, Rebekah, for the presentation and being here with us today. I guess if there's no other questions, this concludes our webinar. So thanks again. Thank you to all the participants who attended today's webinar. Our next webinar in this series is coming up on March 11th, I believe, and more details about that will be coming out shortly. You can find information about that on our website, www.bcsupportunit.ca, or on our social media. Thank you for your time and have a good afternoon, everyone. Thanks, Rebekah.